Here at the Association of Cataract and Refractive Surgery meeting, my colleague, Dr. Fang, is presenting some of my data on DURYSTA, which is sustained release bimatoprost, injected intracamerally for the treatment of glaucoma. And currently this is a product that's labeled for single injection into the anterior chamber, but on an off-label basis, we are able to give a second administration, and we are able to inject not just in the anterior chamber of the eye, but in pseudophakic patients behind the iris, in front of the intraocular lens, in an area called the Iridociliary Sulcus. The potential advantages of placing the medication in the Iridociliary Sulcus are that we can avoid contact with the cornea, which may help preserve corneal endothelial cells, something that's been raised as an issue for intracameral DURYSTA or bimatoprost sustained release administration. And in our series of patients who did have an administration in the sulcus, they did well. Clinically, the efficacy seemed to be the same as those who had the implant placed in the anterior chamber of the eye. We didn't identify any adverse outcomes. We did identify that in some cases, if you place the implant in the sulcus, it may come back into the anterior chamber, but we don't really consider that a problem, as the alternative was just to place it in the anterior chamber to begin with. So, our hope is that even though this is an off-label approach for administering DURYSTA, it will give surgeons a confidence that they can safely administer this therapy in a way that protects patients' corneas and still delivers the good outcomes that we know can be achieved with sustained release bimatoprost. Thank you.